Hello and welcome to another edition of Community Forum. My name is Joseph Feaster. I am the host of the program. And since this is my first show of the new year, I want to wish all of you who watch this program, Community Forum, a very, very happy new year and a prosperous one. And I wanted to begin this new year with some exciting guests, persons who have been in the town of Stoughton and providing such a necessary service that I wanted to have them on in order to explain to you and have you informed about what they do, how they do it, and how you might be able to utilize their services. And for that purpose, I have the Stoughton Visiting Nurses Association members, and I have with me this day the director of the program, who I will just take credit for. My wife says you always want to do that. Take credit for making the director, and I served as interim town manager, Janice Bruce. With her as well is Janet Crimmins, who is a nurse of long standing with the Visiting Nurses Association, and she currently holds position of the Assistant Administrator and Quality Improvement Nurse, and we'll learn more about what that's all about. And now we have a newbie, and that's Jen Sawyer. She's a visiting nurse. She grew up in Stoughton and has been with the Visiting Nurses Association for about 7 months. So to all of you, I say welcome to Community Forum.
Thank you, Joseph.
Well, it's always great to have it. I know when I was interim town manager, Denise, I had an opportunity to see the great work that you and your team were performing. Felt the work that you were doing individually warranted your becoming the director of this program, and I think it says on here that 3 years, how time flies. Right. But nonetheless, why don't we begin by letting our viewing audience know about what is the Visiting Nurses Association, where you're located, and what you do.
Okay. Well, the Stoughton Visiting Nurses, actually our official title is the Stoughton Public Health Association, so if people go looking for us in the phone book, they won't find it under Stoughton Visiting Nurses. So we are an organization, we're a Medicare certified agency, home care agency, as part of the Public Health Department. One of only 2 town-owned VNAs left in Massachusetts that provide home care services to Medicare and Mass Health patients. In our service area is Stoughton and touching towns. And we do skilled services such as skilled nursing visits, physical therapy visits, occupational therapy, social work, speech therapy. And we go in the homes of people throughout the community that their physician feels needs some kind of skilled services to help them get through a recovery process or try to get them back on their feet. And sometimes it's supportive services to go in there and see what other kinds of things that we can connect them up with in the community.
Do you you said you were Medicare and Medicaid, or just Medicaid?
Medicare, Medicaid.
You take both?
Yes.
Do you take any other types of insurances?
No, unfortunately, and that is something that I have on the top of my agenda for this year. We have tried in the past to secure some other contracts with some HMOs because a lot of people now are switching off of straight Medicare. You hear a lot about the changes in the healthcare system and all the insurances. And I actually met with an organization that's part of what they do is help secure for like an agency such as ourselves to get some other contracts. We're waiting to hear back from them because they've been working on a 2-tier system. One is like their premier level, and one would be the base level where we'd go in. We're a small agency. So we're hoping their organization is looking to maybe move away from the lower tier level to the higher level. So we're waiting to hear back. I should have news in March if we're actually able to access their services. But if not, I think that's something that with town management and our procurement department, maybe they can help us access some other contracts because we have a lot of people in Stoughton that have other insurances, and we definitely don't want to, we want to be able to, provide our services to everybody. In fact, a lot of times we'll get a call from a town retiree that says, gee, I'm going in the hospital for a surgery, I'm coming home, we're really hoping that, you can come out and see us when we get home. And I always feel bad when we can't take somebody, especially of our town, that, like my husband just had surgery not that long ago. We couldn't even take him, so I'm like, oh, I really think that it would be.
That really made you a fan at home.
Yeah. So this is really one of my top priorities this year, is to really try to investigate the process of getting some, especially the ones that we offer to our town employees. We have a couple of main HMO insurances, and those would be great.
Well, what will happen is we'll come back, because I always like to talk about how we might be able to be helpful in terms of that process. But I want to get to the persons who actually go out and perform the service, both Janet and Sue. And Janet, I'll first come to you, having been there for such a long period of time and a senior person, and plus this title of, let me see, let me go back to my notes here. You're the title of the Assistant Administrator and Quality Improvement Nurse. So why don't we start there first, explaining what that is, and then let's talk about some of your duties.
Okay. Quality improvement is basically what it says, improving the quality of care, improving the quality of our services that we provide to patients in the community. So essentially what I have to do is chart reviews, go over notes, our Oasis, which is a tool that we use that we have to input data into a base for our payment system. So it's basically going through, making sure all our I's are dotted and our T's are crossed, giving paperwork back to the clinicians, reining things in to make sure that we're doing the right thing.
Are you doing more administrative or oversight
Yes.
now than going out and actually going out into the field and doing some of the
I haven't
home care?
officially hung up my scrubs. I like to think that I would go back out. In fact, I did last week. It was great to go back out and see patients for a little bit. I'll always want to help out and roll up my sleeves, but essentially I'm in the office, yes.
Right. So therefore, that's one reason why you got to the newbie, and in terms of you brought Jen into the mix.
Right.
And I probably will go back to so you can tell a little bit about your backgrounds. But since I'm just thinking of this now, Jen, I'm going to start with you and just say, tell us a little bit about you, because they said you're a Stoughtonite for one.
I am.
But as far as your whole training and how you came to come to, as I've been corrected, that it's called the Stoughton Public Health Association.
Correct. So I grew up, born and raised in Stoughton. I have been a nurse for 1.5 years now. I went to Brockton Hospital School of Nursing. I was working in Hyannis previously to this with a long commute, and I found out that Stoughton Public Health and the visiting nurses were looking for some help, and I was familiar because a family member had had some services. And I applied, and I love working in the community, taking care of patients that, some I know, some I don't know, just giving them the care they need.
Let's talk about it. I'm going to drill down just a little bit, and I'll start with you, and I'll come back to you, Janet. Describe a little bit more in terms of the care, and I guess one of the questions that was posited is how would a person go about getting skilled services? Now, that may be a more appropriate question for one of you, but to the extent that you know, Jen, take me through an assignment. Walk me through an assignment that you would have now as a nurse. What services would you provide for a particular client?
Okay, so we usually get referrals out from hospitals, sometimes doctor's offices, rehabs, things like that. So myself and some of the other nurses will go out and do an initial assessment, go over the patient's meds, check their health issues, make sure they're qualified, see if they need PT, OT, anything like that. And then we pick them up, a couple times a week, whatever is needed for a period of time. Keep our eye on them. Communicate back and forth with the doctor if needed about medications or change in their health status, things like that.
So therefore, so you would recommend the treatment plan that one would have? Would it come from the physician or the discharge nurses? How is that actually done as far as where do you pick up your assignment and what type of decisions can you make? And then Janet, if it's more appropriate for you to respond to that, please do so.
Sure. So we usually get a referral from the doctors, like I said, or a doctor from the rehab. They give us kind of a rundown of what the patient's health issue is, what we need to do, what they're looking for us to go in and take care of. We always do assessments. We always make sure the patients are, aware of their meds, what they do, what they're on them for. And, we communicate back and forth with the doctors if we find any changes that the doctors need to be aware of.
Now, I'm going to come back to you, Janice, because I want to know, I'm an organization person,
Yeah.
so therefore, first and foremost, I want you to talk a little bit about your years. I know you've had more than 25 years of service as a nurse. Why don't you walk folks through your own personal growth into this position of being the director, and then I would like to talk about what Jen was saying. Okay, we go out and do this assessment. How does the business come into the agency, and how is that dispensed out to provide the service?
Right. Well, having been a nurse now for, I don't even know how many years it's been, probably 35 years anyway. I was always drawn.
You started as a child.
Yeah. I was very drawn, especially to, it all started actually when my grandfather got sick, and I think that's where I got my inspiration. I saw what good care he got in a skilled nursing facility in a nursing home, and I think that really impressed me as to what nurses do. I think that was my actual inspiration. And I did a lot of work in, I worked at New England Sinai Hospital. I did a lot with rehabs and chronic care facilities, nursing homes, and a lot of geriatric training. And when I came to, I actually came into the Stoughton Public Health one day for a MAN-2 test. And that's how I got hired. And the director then said to me, have you ever thought about being a home care nurse? And I was like, yes, I have. I was like so excited. And it was like a match made in heaven right off the bat. I just loved it.
And how long have you been with the
I've been with the
Stoughton?
VNA 25 years.
Wow, okay. Now, speaking about the, how does the business come in? How does the referrals come? With whom? I know at one point in time you and I were trying to have a conversation with Good Samaritan about trying to contract with them, and I want to, I'm going to put it out there. It didn't work out.
It
didn't work out, but let's see what
It's amazing through all the years, and as a business person, our root mission of what we do doesn't change, but the business does change.
Yes.
And what's happened throughout the years, especially with healthcare reform in the past 5 years, which there's a lot of great things about healthcare reform, but what it's done is it's really focused our the financial aspect on outcomes, patient outcomes. And that's something that we're really working on. And if you've probably read a lot about hospitals now getting decreased payments for readmissions, what they really want us to do is to really drill down, provide better service for less money. It's really what it's about, the reimbursement factor, because Medicare they thought was going broke, and they're really trying to incentivize hospitals for doing a better job, VNAs for doing a better job. So there's a lot with CMS, Centers for Medicare and Medicaid, as far as reimbursements go. Everybody has repositioned themselves to be a part of the playing field. It used to be all towns had their own VNA. And as you can see now, so many towns, if we're only one of two, which I think is a shame, because I think there's something to be said for being owned by the town and the community you live in and providing those services. But you see a lot of them have partnered up with bigger organizations because it is a business, and trying to maintain that aspect. Sometimes you need the bigger group. But we this year especially are really focusing in on the whole outcome-based care, and really, not that we didn't before, but we're really seeing that this is the emphasis where where healthcare is going, is to really be able to show those improvements. If we can avoid people going back into the hospital unnecessarily, we're really trying to give them the tools to know when to call the doctor before it reaches a point that they need an emergency room visit. Call us first. Maybe all it requires is a call to your doctor. Maybe he can start you on change up your medications before it becomes a full-blown infection or a deterioration of your heart condition. So it's teaching people when to notify and taking charge of their own health care. So
Well, let me go to Janet for a minute, because it sounds like we're moving into the direction of some of the things that it sounds like to me you would be involved with, both on the side of looking at it from an analytical standpoint in terms of the information about quality, but also some of what Janice has talked about, communication with the patient, with the medical institution, et cetera. Why don't you elaborate on that a bit, just talking about how you actually go about doing that?
Right. So when you start, say, from the referral perspective, so lots of times in the hospital we'll refer a patient and they'll suggest, an OT, PT, home health aid eval. So then it's up to the nurse to go in and make that assessment of what the patient might need. By the time it gets to me, then it's more, is this medically necessary? Are we reflecting skill in everything that we're doing? Those kinds of things. And then you have to be showing improvement. And why are we in the home seeing the patient in the first place? So it's kind of wrapping it all up into a nice package that Medicare would look at and say, okay, well, these services are necessary, and would pay for the services. So
Are there times when those, what you might recommend is declined?
unfortunately, yes.
Yeah.
So again, it's reflective. We don't take enough credit lots of times for the things that we do. We don't tend to document that. We do a lot, but you need to reflect that in what you're writing. So I think as clinicians, we tend to just be hands-on. We do what we have to do. We do the task at hand, but then don't reflect it necessarily in what we write.
Yeah.
So that's where I come in and have to, encourage people to write more of what their skill really does show.
So Jen, when you're out there performing your services on site at a patient's home, and probably that's where your locations would be, at the person's residences,
Correct.
not in the hospitals, obviously.
Correct.
What type of reporting do you have to do? I don't want to violate HIPAA laws, but but what type of things? Because I'm sure that in reporting back to Janet and back to Janice, you have to provide certain information. Is there, how do you go about documenting what you have provided for that patient?
So I need to make sure when I go out there and I do their assessments, I need to document, any changes that I see with the patient. Say they have CHF and their weights are up.
Okay, you got to give us undocumented,
Oh, sorry about
unknowledgeable
that.
person,
Sorry.
CHF. I may go in an entire different
Sorry
direction with
about
that initial.
Okay, so say a person has congestive heart failure.
Okay, there we go.
One of our big things to monitor daily is their weights. If they're gaining more than 2.2 pounds in a day, we need to contact, or I need to write down, patient has gained 2.2 pounds, because that's an indication that they're holding fluid. Their heart is going to be having trouble. So we need to not only document that, I need to let the doctors know, boy, what would you like to do in this circumstance? Would you like to up their Lasix medication, to diurese them, to get rid of that fluid, to make their heart work better? Things like that. Any declines that I'm seeing, if a person's mobility is decreasing, and I need to write that to make sure that we're getting some skilled physical therapy in there to help them. Things like that we, as a nurse, I need to be, documenting, so not only do the other nurses that might go in after me know exactly what they're looking at, but that Janice and Janet, looking at the charts, also know exactly what's going on and how to further treat this person.
Now, going back to something that you said, Janice, and Jen, thank you for that. But I'm going to drill down so our viewing audience has a pretty good sense. Jen, you're doing this documenting, or any nurse that may be performing those services are documenting that. To whom do those reports go? say for instance, you diagnosed the one about the person having congestive heart failure. Does it go to the doctor? Does it go to Janet? Does it go to Janice? Or does it go to all? Who would make that decision about what would be the next treatment option for this patient?
Definitely go straight to the doctor.
Okay.
You know, we follow doctor's orders. We can't make any kind of medical changes to the person's care plan without the doctor's orders. So we do that, and then it is documented in the chart that if Janice or Janet needs to look back at that, or a new nurse, they can look back and say, oh, this is exactly what happened on the last visit. Jen contacted the doctor, and this is what the doctor said and how to treat this issue.
Okay. This is going to be an operational question, and I'm not sure, Janet, if it'll be for you, and I know certainly for you, Janice, but you may want to give Janet a chance to chat.
Probably I will.
But I'm sitting there, and I'll take either a patient who is now in need of home care, or in terms of family member, has a family member who needs home care. How do I go about, if I'm interested in having you provide those services, how do I make that happen? I know somewhat about so-called discharge nurses or case managers when you're in the hospital, and they facilitate some of that, but how would they get to you to do that?
Do you want to do?
So you're talking somebody at home that might want
No.
to set
Someone
up
who's now
something?
about to leave a hospital.
Okay.
About to leave a hospital, and either it's the family member who's trying to make that arrangement on their behalf, or
Right.
the patient themselves, or a case manager or discharge nurse. I'm not sure how in each and every instance that's handled, but if they wanted to get the service to you to provide that for them,
Yeah,
how
I
would
mean,
they,
like
what would
that
be the
happens a
process?
lot where patients request our service.
Yes.
And let me get that out there, that everybody has the right to choose which agency they would like to have provide their service.
Can you state that once again?
I know.
In fact, look into the camera and tell them they can select your organization.
That's right. You do have that right. Obviously, if you're a Medicare and a Medicaid patient, but having said that. So, yes, it usually would come from the case manager, a referral that would get, now it's computerized, it comes through the computer. Are you able to accept this patient? Then we have to respond to that. Then the whole referral process goes through fax and paperwork, usually. But we do have patients, families that contact us directly that say, Mom and Dad are due to come home. We want your services. You know, we've had them before, but they're trying to give us to a different agency, you know, and we have to just say, well, you have the right to, you know, ask for Stoughton Visiting Nurses. So,
is there any, from any time limitations on the home care of a person? Is that related to what the rules and regulations are for Medicare and Medicaid and the type of coverage they has? Are there time limitations?
Well, we work under something that's called conditions of participation, set up by Medicare. And one of the conditions of participation is that the visits have to be considered skilled, reasonable, and necessary. Person has to be considered homebound. It doesn't mean they can never go out. They can go to a church service. They can go to get the barber or whatever. They can go out to a family function with assist, but it all has to be clearly documented that it's not their usual activity. They're not out going to Shaw's or Stop and Shop. It has to be a taxing effort for them to go out.
You didn't mention Market Basket. Come
Market
on now.
Basket.
All right, Denise, don't start advertising on this program, please.
but the homebound, it doesn't mean they can. I feel bad because people think homebound. You can go out. You can go to a family function with assistance. It just means it's a taxing effort and it's not your usual activity at this time. But one of the conditions is that we are considered intermittent skilled services. In other words, we're not usually in for like lifelong services. It's usually for a period of time to help a person get better, or to make referrals to somebody that could provide supportive services. There are those rare occasions that somebody, however, might be on for a very long time if there were nobody else to say they had a wound that they were not able to reach or dress, and there was nobody else to teach or to get to do it. And we may be in there for quite a while as we're working on providing something like wound care or something else that is sort of a more chronic kind of a condition. But most of our people, I would say, we work off of Medicare 60-day episodes. A lot of times people think we get paid, like we go out, make a visit, and then we get paid for that visit. That's not how home care is. We get paid off of something called PPS, Prospective Payment System. So our orders go for a 2-month period of time, 60 days. And the assessment that Jen would go out and do is a 21-page assessment form. All this information gets factored in and sent to Medicare. And it's based on your diagnosis, the severity of your diagnosis,
Coding.
like there's all codes according to your diagnosis, and that generates in a very interesting formula that's hard to crack. I don't know who can figure this out, but it's this formula, and they come up with a dollar amount for that 60-day episode of care, for which you basically, it's like your budget to take care of this person for 60 days.
Okay. What, can you provide services to someone who doesn't live in Stoughton, or even stated another way, are there any other communities that you could provide services for other than Stoughton?
Yes, we actually, our service area is all of our bordering towns, so Avon, Randolph, Easton, Sharon, Canton, Brockton. Did I forget anybody? I think that was it.
Yes. So therefore, persons who reside in those areas and need this service could call upon.
Absolutely, and we do try to make ourselves known out there too, like we do. I was just contacted by the Canton Council on Aging, wanting to know if we could maybe do some health little programs over there, which is great. We'd love to. They're part of our service area, and we'd love to be able to go over there and participate. We do at the Stoughton Senior Center. We'll go up and do a little program, and a health teaching kind of a program. And so when we were contacted by Canton, I said, absolutely, would love to, go over there and let people know about us, and maybe pass on some good, important health information. And so we look to our neighboring communities. We're part of the public health department. Janet goes to a lot of the public health meetings, which we're friends with a lot of the nurses over in the other towns too. We connect up on they don't have a home care agency per se, but they're part of the public health, and we do those activities as well as our visiting nurse activities.
I'm going to come back to the public health piece, but I want to focus on two areas where we had a lot of, at least last year, a lot of discussion about one, Ebola. And two, we're in the season which there is now talking about what I would, I think not I, but I think the governmental body, the CDC, I think it was, has declared that there has been a flu epidemic across the nation. Is the Stoughton Public Health Association giving flu shots? How did you respond to the whole issue around the Ebola? I know I had the fire department here, and if you saw that program, we had them in the hazmat suit and displayed how that is put on and some of the concerns. How did the Public Health Association respond to that, and also about giving flu shots?
Well, I think with Ebola, of course, I think that caught the whole country off guard, and I think we learned a lot through the start of that first case in Texas. I think it showed us that we weren't as prepared as we thought we were, and that it wasn't just their problem, or it's not just the problem of the other countries that are facing it. It could potentially be a huge problem here. But I think once we realized that that gentleman had left the hospital, we learned a lot about training, as the fire department is doing, with those hazmat suits. I think
Did you go through that training?
I went to a fire department sponsor. We didn't do the training. We're not on the front lines like the fire department would be. I think for us, it's more recognizing. We're most likely not going to have someone walk in the town hall and say, I've got a flu and a fever. But it's for us to know how to respond if there's a problem.
Okay.
So I did go to a training that the fire department had sponsored over at the police station, and we get weekly updates. I listen to the DPH has weekly updates on Ebola, and where it gives you the rundown of what's happening, a lot of different statistics, trainings, concerns, which hospitals would be the hospitals that a person would be able to go to. And also like screening people, like, which I'm sure the fire department is doing now. If they got a call with somebody with a fever or having those symptoms, they would first have to find out, had you traveled? Where had you traveled? Had you possibly been in contact with somebody? So it's finding those things out right off the bat, so that you know what you're dealing with before, you know, you're sending people out into the community. So it's not to be overly afraid, it's just to be prepared so that we know how to handle it. So I think that we keep up, our department does, with knowing exactly where we're at. Thank God there are no cases right now, in the United States.
How about, Janet, how about the flu shots? Is it too late for folks to get it? And then lastly, maybe Jen, talk about, can you dispense it at the home care? So is it too late for folks to get it? If someone looking now and has decided that they, and can you talk about which is the particular cohort of the population that it's suggested strongly that they get it?
Well, it's not too late to get a flu shot. In fact, we still have a lot of vaccine for the over 65 age group. We don't have any more of the regular. So, so anybody that wants to still get a flu shot, it wouldn't be too late. We just had some people come in the other day, so people are still calling about that. What was the other part of it?
The other question was, well, and this may either you or Jen, can a person who is homebound, can they get the flu shot still, or do they have to be taken into some place in order to get it?
No, so we do encourage a lot of that, because there are elders in the home and people that are caring for them that can't get them out to a doctor or to one of our flu clinics. So what we do is just have them call their physician and have them fax over an order that they can receive the flu shot, and we'll go to the house and we'll give it to them.
And I think I've read at various times that you have been also have provided days when you would provide the flu shots. I think in town hall and other, maybe even over at the Stoughton Senior Center as well. Is that still something that you do on a recurring basis, or was those just one-time basis? What was the circumstances around that?
Well, we try to do those early in the season, so those are usually September, October. So we haven't had any scheduled clinics. But we encourage folks to just, either give us a call to make sure there's a nurse in the office. I'd be happy to give them the flu shot.
Well, I know we have your number going to be coming up when I give the announcements. Why don't you give them a number that they would call if they were interested in reaching you for any reason?
781-344-7011. Not sure where I'm looking.
Well, in terms of your camera is right there. They got your lovely face on there, Janet. You don't have to worry. We'll make sure we move the camera for you. But why don't you repeat that number for them again?
781-344-7011. And that's only just to make sure someone's actually there. You hate to have somebody come. But on Thursdays from 4 to 6, Thursdays the town hall's open late. We encourage any Stoughton resident to come up to talk, converse with. We call it our converse with a nurse. You have any issues that you want to discuss, we're there.
Well, I know I came in at that. I saw the door. There was such an inviting sign on the door when I came up the other day.
We're working on that.
Oh yeah.
Little tiny sign says come in.
I don't know. Don't make me have to go to the town manager's office to demand that you get a sign that works. But in any event, it was inviting nonetheless, Janice. I did come in.
Once you open the door, it's very inviting.
Oh, absolutely. In terms of one of the nicest places in the building.
We would love people. We want anyone to stop by. We keep the door shut. We're right next to the elevator, and where we are a healthcare agency, and with HIPAA and all that, we think it's best that we keep the door closed. But we want anyone to come in and say hi. Yeah. So.
Well, I'm going to take a moment to pay a few bills and and to let folks know about who our sponsors are. But when I come back, I want to talk about your other responsibilities as a public health place. Jen, I want to get you into the mix in terms of some of the things, and you can think about some of the areas that you might want to explore. And then, before I do go, I just want to, I was reminded by the producer, Roy Cohen, of, you have come, let me say it, Stoughton VNA, and they got it all wrong, because I'm glad that somebody else did as well. The Stoughton Public Health Association made the 2014 Home Care Elite list, and I'm going to let you talk about that when we come back.
Hi, it's Gary LaPierre, and the crew wants to thank Maxie's Delicatessen. That's at 117 Sharon Street in Stoughton. They're 781-341-1662. American Cancer Society, Yes, they're looking for volunteers. Drive cancer patients to and from their treatments. 1-800-ACS-6662. Or just go to www.cancer.org. Ilsa Mark's Food Pantry in St. Anthony's Free Market, 2 Park Avenue in Stoughton. For more information, call Christine Gallagher. That's at 781-341-0611 or 781-341-0549. Meals on Wheels. Just ask for Jessica. You'll find her at 781-344-8882, extension 2. Stoughton Penny Saver. Our business is advertising your business, they tell us. 27 Rose Glen Street, Stoughton, 781-344-4833. Community Forum showtimes in Stoughton. It's Thursday, Friday, Saturday, and Sunday at 6 p.m., Monday at 8 p.m., Tuesday at 5 p.m. It's on Comcast Channel 9 and Verizon Channel 28. All comments and suggestions welcome. Contact us at communityforum1@yahoo.com. Community Forum showtimes in Easton. Mondays at 9 p.m., Tuesday at 8 a.m., Wednesdays 3 p.m., Saturday 10 a.m. And that too, Comcast Channel 9, Verizon Channel 22. Samaritans, they're at 41 West Street on the 4th floor in Boston, 02111. Their phone number is 617-536-2460. 24-hour helplines for Samaritans, and the number is 877-870-HOPE. That's 877-870-4673. Samaritans, you can find them at 800-252-TEEN. That's 252-8336. Or find them online at SamaritansHope.org.
You're invited to the Community Food Drive. This is being a program sponsored by the First United Methodist Church, which is located at 103 Pleasant Street in Stoughton. They're looking for you in celebration of the Martin Luther King Jr. Day of Service on Monday, January 19th from 10 to 1 p.m. They would like for you to bring food products for our needy, and you can drop them off at the church at 103 Pleasant Street in Stoughton between 10 a.m. and 1 p.m. on Monday, January 19th. Murder of the Mystery Detective. This is a play you're not going to want to miss. This is put on to support our library. It's presented by the Support Our Library Association, or SOLA. The play will take place on Saturday, January 24th from 7 to 9 p.m. We want persons 21 or older to attend because we have such stellar actors and actresses, they don't want to have any interruptions. And this play will be held at Avat Torah Congregation, 1179 on Central Street here in Stoughton. And if you want tickets, they're available at the Stoughton Public Library. You can get in contact with any of the cast members, and if you read your penny savers, those distinguished stars are listed in the penny saver. But you can call 781-248-2123. You can look at Facebook, or you can message Dory Frankel. She would have the tickets as well. I'm going to be there. Hope that you will join us. The second Stoughton Downtown Redevelopment Public Forum, and this is an opportunity for you to learn what's is being planned for the downtown. We need you to come, hear it, participate, give your opinions. They're going to hold this on a Saturday to make it convenient for a lot of us. Saturday, January 31st, at 1 p.m. is registration, and the workshop will be from 1:15 until 4 p.m. on that Saturday. It's going to be held at the Stoughton High School cafeteria. Please come out. We got to participate. We got to let those who are being involved in the planning know what you think about what they're planning. So come on out on Saturday, January 31st. Stoughton Public Health Association, the visiting nurses who are here in the studio, they're located at Town Hall on the 2nd floor. And they want you, as I said, open door policy, pop in, particularly on Thursday, since the town hall is open late on Thursday. You can pop in, see them, ask questions, sign up to be able to have them provide the home services. But if you need to call, ask any questions, you can call 344-7011, or you can reach them at you can look at their website, townofstoughton.org. And now we're back with my guests, as I mentioned at the top of the program. We have Janice Bruce, who is the director of the Stoughton Public Health Association. Next to her is Jen Sawyer, a nurse with the association, and now since she's been on this program for about 40 minutes, she's no longer a newbie. And we have Janet Crimmins, who has been with the Stoughton Public Health Association for many, many years and serves as the assistant administrator and quality improvement nurse. We've been talking about what you do, how you do it, how folks can get in contact with you. We've talked about that they can get flu shots, how you went about at least educating yourselves on how to address Ebola issues if they were to arise here in any of the communities in which you serve, and working along with the fire department. But I know as the public health department for the town of Stoughton, there are other services that you provide, other things that you do, and I know that you mentioned, Janice, that Janet is the one who goes to those meetings. Mm-hmm. So Janet, do you want to tell us about what those other involvements are?
Public health, communicable disease follow-up. We get all communicable disease cases reported to us through a reporting system, Maven, which comes through DPH. So I have to check that daily, sometimes twice a day, just to make sure that anything that's immediate needs to be followed up immediately. So that would be any foodborne illnesses that we get contacted about. So obviously you'd have to make the phone call if someone, Salmonella, Campylobacter, Giardia, those kinds of things that might come from food sources, restaurants, daycares, things like that. We do all that. We do blood pressure clinics in the town. We do them at the elderly complexes on Thursdays. The senior center, the first and third Thursday of every month. And what else?
Well, we've had our flu clinics. We also do the rabies clinic in the spring for our town's pets, which is important too. We sometimes we recognize the pets sometimes before the owner. There's a lot of houses we go into, we see them. We do that with Dr. Malik from Lloyd's Animal Hospital. And we do like health teaching, or like I said, we do educational programs at either the senior center, or if anyone requests us to do any kind of a little presentation at any of the housings or whatever, we can do that. And we work alongside the Board of Health with things such as inspecting the summer camps. We have the state regulations as to immunizations. We go and we check the campers' records to make sure that that the kids have had their immunizations, they're okay to start camp. So we kind of try to coordinate with the different departments in town, and I, again, think that is a strength of having our agency in the town, because we do a lot with the fire department, the COA, the Board of Health, and we're all kind of integrated, which I think is nice, because sometimes we go in and see a patient, or we get a referral, and it might not be skilled services, but we happen to know of services in the town that this person would benefit from, either through the counseling on aging, or an outreach person to go in and help them with their finances, or something like that. So when we're community-based, I think it's very cohesive. Or we may see a Board of Health issue, or they may call us, where they may have say, gee, this person, I got a call, this environment is really bad, but I think maybe a nurse should go in and as public health, go in and see what's going on. And if there's something significant there, then we can, try to work with the family, or even call their physician or whatever to see what's happening.
So Jen, would these be the types of things that you might identify and put into your report, or bring to the attention of either Janet or Janice, some of the things that Janice stated here? Would that be some things that you might do?
Yeah, I think sometimes I would. you know, I have been part of the flu clinics that we do. I have been part of the blood pressure clinics,
Jen just does
things
what we
like
tell her
that.
to do.
I'm just a go with the flow kind of girl over there.
What I'm saying, for instance, here, as Janice pointed out, you go into a house, you find out, say, for instance, you see a infestation problem, and particularly if as we know, they talk about in terms of roaches provide, you know, or animal droppings or whatever the case might be. Would that be something whereby you might have a conversation with another part of the department, make that type of at least observation and a note it, or and then have a conversation internally as to what might be the corrective action?
Absolutely, yes.
Yeah.
You know, I would notify them immediately what circumstances I have found. We are mandated reporters as nurses, so we do have to follow up on things like that. Not only, you know, safety in the home, you know, any abuse may be going on in the home, uncleanliness, you know, bugs, things like that. We do have to report those right away.
And that's where the public, if I could just
Go
say,
ahead.
the public health piece also, if patients that we do, say, a well checkup, you know, if doctor's office calls, because we are the public health, we would be more than happy to go out and evaluate somebody that might be out there at risk as a public health visit. You know.
Would your public health side, say for instance, one goes in and contracts food poisoning? They've eaten at a place, they've contracted it, or they've gone into a grocery establishment and they've done that. Would that be something which would come under your area of responsibility or someone else in the town?
Well, like I said earlier, it would get reported. So
Yes.
anything that's a foodborne illness gets reported to DPH, then it comes to the communities where that person lives. So then I would have to follow up. So you take a history, you have questions you have to ask, and if it's, you know, they ate at such and such a restaurant that might be in Stoughton, well, you wouldn't necessarily have to go check out the restaurant right away unless maybe you had a cluster of cases.
And then the Board of
You
Health
know,
would
and then
be-
the Board of Health would have to take a look at that. So
Now, you just related so many different functions which your office provides. So with your staff of 500 that you that you have there, you know, that's joking for sure, because I know better than that having been there. What is your staffing component at the present time?
We have, as far as our total staff, is probably about 20 people. Some of them are, you know, clerical, and then as far as our nurses go, we have 3 nurses usually out on the road every day, and then we have a handful of per diem staff that we're able to tailor, like if all of a sudden we get busy or a regular nurse is on vacation or whatever, pull in more of the per diem help. And we have our therapists that are per diem too. So we have 2 OTs, 2 physical therapists, social worker.
Is that sufficient for the demand?
Right now, but if we get those HMOs, we may be looking to grow a little bit. You know, that would be great if we're able to expand our business out a little bit.
Well, I want to come back to that because I want to come back. I'm not going to have you leave here. Well, first and foremost, I did say at the break, and I want to be true to my word. I wanted you to describe what this home care elite list is all about, and then I want to come back to that insurance issue. That issue of, you know, trying to what we try to do as far as getting into a relationship with Good Samaritan, et cetera. I want to maybe even end the program talking about this because I like to be able to have our citizens help us do what we need to do. And, you know, I believe in lobbying. I believe in terms of people participating. So if there's ways that they can be influential in helping you achieve your objective, whether it's the politicians in town or the citizens in town, I want you to have an opportunity to air it. And you can tell the town manager, I drew it out of you. You didn't do it voluntarily. You can do it on community forum. But let's first talk about the home care elite list. What's that? What is that designation? It sounds really, I'm just reading, it's something, the top 25% performing home health agencies in the country.
Yeah.
Woo-hoo.
I know.
Mayberry,
I was going to say, we may be small, but we're very mighty. Well,
right.
I think what that was is that all of our information goes into a big database that's actually, everything's on record. You can go on Home Health Compare, on the website Home Health Compare, and you can look up all different agencies. But anyway, what happens is all this information and our outcomes all are compared. And this is a recognition we got recognized for patient satisfaction and for good outcomes. In this, so it was the top 25% of the home care agencies that
Is this
made that.
Is this on the town's website? Yeah.
I don't know, Joseph, I have to check
you
that
gotta
out.
check. You ready? When you go back,
I know, all right.
call that IT person
Okay,
up.
all right.
You know, speak
You're
to that
right.
town manager.
You're absolutely right.
Oh,
And I want to
absolutely.
say that, when considering that we are the Stoughton Public Health, we're the hometown agency. There are 3 other VNAs in Stoughton, and we are sandwiched between a couple of hospitals that have their own VNAs. So I feel very proud that we did this because we're the only VNA in town that did make that list.
Good Samaritan, do you hear this? Do you hear this? Can we reopen those conversations?
And the thing with being partnering, we're all in this community. Our local fire department takes our patients to their emergency room. So we want to partner. We feel we do a great job, and we want these patients to be able to come home to us, like our logo says, come home to us. So we want to be a good partner to the hospitals and to the physicians, and we want them to know that we are working for the patients just as hard as they are, and we want their outcomes to be good too.
Do we have any relationship with Brockton Hospital?
We not as much as probably because they're on the other side of Brockton. We don't tend to get as many patients, probably because of location, but certainly some of the local doctors use Brockton, and but
Well, the question would be, how might we be helpful, either from the standpoint of the town in general, in order to try to facilitate those types of conversations? I know Good Samaritan, when I had the conversations, would want to be a good neighbor, and certainly, but how can we possibly facilitate those conversations? Do you have sufficient time in order to engage in those those efforts?
oh sure, I have. You and I met. With the president, and I know Mark Doloff, being the fire chief, has met. I'll steal a line from our fire chief: help me help you.
There you go. I wanted to get him in the hazmat suit, but he put someone else in it. We wanted to get him in it. That would have been a great shot. No, I think that, again, and I'm just going to encourage, and I really think that this might be a matter which is taken to the selectman's office. I really think that it's that important. As you pointed out, we're only one of 2 towns in Massachusetts that has its Visiting Nurses Association. There are competitors here, and I think from a business standpoint and a marketing standpoint, that you shouldn't have to go it alone.
Right.
So I think there should be a coordinated effort, and I'm challenging, our officials here in town to help support that, and maybe they can have that type of conversation.
I'm hoping so too. I am waiting on hearing back from, it's called VNA of New England Venani, and they're the ones that I have met with about the contracts to expand our base, but for insurances. So hopefully, if that doesn't go the way I want it to go, I'm hoping that the management in the town might be able to give us a little hand with getting some of those contracts.
We're coming to near the end of the program, and I don't want them to pull the plug on us, but I do want you to give you an opportunity, and I'm going to start with you, Jen. Any parting thoughts that you would like to share? And then I'm going to come to you, Janet, about any parting thoughts that you'd want to encourage our viewing audience to consider?
Please use us. We are, a great group of staff. We care about our town people and the surrounding communities. We're not only available, 8:30 to 4:30, but for any of our patients, we always have an on-call nurse on at night and on the weekends, that somebody is always around if you need us.
My goodness, I'm going to have them at the end of this do a promo with you giving that exact statement.
Very good.
Except for 3 o'clock in the morning.
That's right. Say, Mr. Producer, can you make sure that make sure that we get Jen on here to do this promo for it? Janet?
Well, to piggyback on what Jen is saying, I think what makes us unique, and I've had experience with my own family with different VNAs and agencies, and I always come back to what we offer, and it is that homespun kind of feel that the majority of our staff live in Stoughton, if not in the surrounding communities. So we have that cohesive group. You have consistency with staff. You have a nurse that's assigned to your case and generally is the one that you will always see. And I go to enough meetings that I hear these big agencies, you know, you're a face, you're a number, you just have a different nurse that comes in all the time. So I think as far as that connection that we have is big. And when you live in the town and that you're seeing these patients that you're going to bump into in the supermarket and to CVS, and you know, you take you go the extra mile. I think that we do that. So. Well,
my mother-in-law's experience is she's going to need home care. But she's in Boston. I may have to bring her out here just so we can
Right.
utilize your services.
Absolutely.
I mean, I'm very serious about that. You know, and because it is a traumatic experience for all, and as you said, Janet, it's a question of they may just send anybody.
Right. And when you see the same nurse, and if you have a good rapport, they look forward to seeing you.
Right.
You know.
You know, you become part of the family.
Right.
You
Right.
become part of the family, and I think that's very, very important. Janice, any parting words as the director?
Well, I don't think I could do any better than these two did, but again, I think we do a great job. We are here for our town and our patients. You know, so feel free, just give us a call. If you have a question, we have people come up all the time and just run something past us.
Why don't you give
think
that phone
this
number
is-
again so they have it?
Yeah, 781-344-7011. And if you forget it, call the town hall and ask, get connected to the nurses that way.
And as you said, you know, come up and visit them on the second floor of Town Hall. Stop in, ask a question. Even if you can't utilize their services, they are so efficient that they're able to give, you know, you are able to give them advice and suggestions as to things that they might do, places they might go, and how they may be able to service some of their home care and medical needs. And as Jen says, you know, I'm going to be the eyes and ears while I'm out there in order to make sure that the person is safe and is going to be attended to properly. So I think that our residents of Stoughton and the surrounding towns can't lose by calling into the to our, and I want to get it right, our Stoughton Public Health Association. As been noted here today, there's more things that they do as far as looking at the health welfare for us here in Stoughton, and we're much appreciative of that. I certainly want to thank you for being here today to enlighten our viewing audience. I already know what great work you do because I witnessed it on my own when I was there. And I just want to thank you guys for being here today. This doesn't have to be the last time.
No.
You can do it again. But I want to encourage those selectmen, town manager, you know, the town meeting representatives. Let's get some more of these contracts. So again, thank you so much for being on Community Forum.
Thank you for
and
having
definitely
us.
have a great
Joseph.
day.
Thank you.
You too.
Thank you.